On behalf of the International Bipolar Foundation, I would like to introduce Dr. Michael Knable. Today, Dr. Knable will review the growing trend for consumers to use computer and device-assisted therapies to help manage illness and communicate with providers. He will also discuss the CyberGuide project, which seeks to provide unbiased ratings of these products so that consumers and their families can make informed choices. Dr. Knable has been involved in psychiatric treatment and research for more than 20 years and is the author of more than 70 publications on various aspects of neuropsychiatric disease, including Surviving Manic Depression, a manual on bipolar disorder for parents, families, and providers. He currently holds many clinical leadership roles and is Vice President for Medical Affairs of Access Healthcare Group, LLC. Welcome, and thank you for talking to us today, Dr. Knable.
Thank you very much, Debbie, and good morning or good afternoon to everyone, as the case may be. And as Debbie mentioned, I would like to briefly review this field of e-mental health, computer and device-assisted therapies for mental illnesses. And I'm not really going to talk about specific devices or specific modalities as much as I am about efforts to review these and review the claims that are being made by these products. This is a very rapidly expanding area and a very new way of delivering health care, and it's a little bit like the Wild West. And I find frequently that patients or their families know more about this than I do because these products don't go through the typical channels for people working in hospitals or offices. And we're trying to develop a system to understand which of these are worth investing in and recommending to patients. So as all of you may know, these products are not really regulated by any government agency like the FDA does for medications. They are usually not studied in clinical trials. And so there are a number of different groups that are forming around the world to try and look at these products and evaluate them. And as Debbie mentioned, the one that I work on, which is a project of the International Mental Health Research Organization, is called CyberGuide, PSYBERGUIDE. And I have a couple of slides about that later on. And we're trying to become sort of the most comprehensive and unbiased site where people can go and look up information about these products. So why has this expanded so much? Well, first, as all of you know, the ability to have very rapid and accurate mobile computing technology is all around us now, and it's only getting better, as are social media sites, which are becoming increasingly differentiated for different communities of people. And so now we have the capacity to deliver care remotely or to have people manage their own care much more completely. Another reason this is important now is because we're all becoming aware that large parts of the world, including many parts of our own country, do not have adequate numbers of mental health providers. It's very difficult to get appointments, to get in to see people, and to have regular coordinated care. In addition, in many locations there's a tremendous need to have better coordination of care. The mental health system in our country is very fragmented, and so communication between hospitals, day programs, residential programs, for example, and outpatient clinics is usually quite poor, and which leads in many instances to kind of a revolving door where people are hospitalized, sometimes unnecessarily, and this kind of coordination between different sites can be much more easily achieved with certain kinds of electronic technologies. Next, young people, children and adolescents have been traditionally very difficult for us to reach as professionals. They usually don't like going to psychiatrists and psychologists very much, and it's difficult to engage them. Well, these young people are already very familiar with social media, gaming technologies, and I have observed that frequently it's a very good way to engage people and get them started in treatment if they need it. And also, finally, many patients want to take a more active role in their own care and in their treatment and recovery, and they're capable of devising self-guided programs, and electronic technologies can really help with that. So the main types of treatment, we've broken them down into categories, which are listed here. Cognitive remediation got started about 15 years ago, initially with the idea that computers could be used to help improve cognitive strengths like memory, attention, social skills, mainly for people with schizophrenia. And there's an active research program going on, and many NIH grants are going to this field still. The fields in bipolar disorder and depression are much less developed, but we're hoping that'll change. Most cognitive remediation programs are available through clinics, so you have to go and participate in a clinic and have a professional kind of guiding it. And they're not available widely in the country, but usually in certain academic centers or certain there are some public sector programs that have taken on these programs, mostly on the East Coast, but they're not particularly widespread yet. Cognitive training products are all over the place, and they are designed for the general public, not necessarily people who have been given a specific diagnosis, but these are marketed to people with the claim that you can improve your memory, preserve your memory, and prevent the onset of dementia or memory loss associated with aging if you practice these programs. And Lumosity is the best example of this. It's advertised very widely on television and does have some studies to back up its claims, although maybe not as deep as we would like them to be. And Posit Science is another company that's been active in this area, and you may have seen some of their advertisements. Now, cognitive behavioral therapy is an old, tried and true method of psychotherapy that has been shown in many studies to be useful for a whole variety of mental illnesses, including the more serious ones. And now people are figuring out how to give cognitive behavioral therapy on devices where people can kind of do this on their own. And the best example that I've seen is called Coping Tutor. And this product is mostly designed for people who are experiencing auditory hallucinations, but there are some others coming on the market as well. Symptom trackers, they've been around for a long while in paper versions. You may remember the life charting method or mood charting methods. So the ability to chart mood swings and to link them with life events or medication changes and have them in a database can be very useful for people to help predict phases of illness. Very useful for providers to be able to get an accurate history of how things go. And there's a whole range of these things that are being developed electronically now. Education and coping skills are more about describing various aspects of illness and medications and side effects. And then finally, electronic case management is a more elaborate kind of system where people may chart their moods or may chart their medications or may chart different aspects of how they're feeling. And these are reviewed by case managers. And if certain levels of distress are reached, the case manager will go to the patient and help them and try to understand what's going on and try to avoid a hospitalization or another type of crisis. And many healthcare systems across the country are thinking about how to integrate these into their systems. So, shortage of mental health professionals, I mentioned this to you. This was a report from the Department of Health and Human Services. I found it quite amazing that 55% of the U.S. has 3,100 counties, And more than half of these counties have no practicing psychiatrist, psychologist, or social worker. So in many instances, people have to travel great distances to get help, or help is just not available. And in this report, they also concluded that about 91 million Americans live in underserved areas. Now, even in areas where there are providers, it's frequently very difficult to get help. This was a study that was in the Annals of Emergency Medicine about the difficulties people have of getting appointments to see psychiatrists. And I understand this because most psychiatrists are in private practice and they have small offices without much staff, but nevertheless, I found these data quite interesting that about 45% of the time, if you call a mental health center or a psychiatrist's office, you get an answering machine, whereas only 8% of people who call medical offices get a machine rather than an actual receptionist. 31% of callers to mental health clinics were able to determine for sure if they would get an appointment or not, compared to 78% for medical clinics. And the overall appointment rates in mental health clinics were 22% for privately insured patients and 12% for Medicaid. So, and I've seen this many times in my career that people can't find a psychiatrist, or one that takes their insurance, or one who's not booked up for weeks in advance. And so this is another force driving us towards more self-directed care. So with regard to the products that are coming on the market, this field is really exploding. When I last checked, I was able to find out that there are about 3,000 mobile apps that claim to be specific to mental health and addictions, and 558 of these could be targeted for specific conditions, or claimed to be for specific conditions, although there's tremendous overlap between them. So here you see some numbers on the claims for anxiety, autism, attention deficit disorder, depression, and then a variety of other indications. And as I mentioned previously, most of these are not tested in studies, and they are very difficult to compare one to another. In many cases, it may not be that risky because many of them are free, but some of them do charge fees, subscription fees or initial fees, and it's very difficult for any doctor or any patient to say, well, I think this one's best and we know this one will work. So what I really want to focus on today is how will consumers know which products are of good quality. So the first group I'm going to talk about is MHealth Evidence. And this is a site that's maintained by Johns Hopkins University. It's a nonprofit site, and it was funded by the U.S. Agency for International Development. And they sought to address this core challenge of a limited evidence base, and they tried to catalog, categorize, and grade MHealth evidence, and they're trying to do this for the entire field of medicine. What they have on their site is mostly a bibliography of papers from peer-reviewed literature and so-called gray literature being blogs, internet sites, and other kinds of publications that are not peer-reviewed. And this site rates the studies rather than products. Yeah, they plan to expand, but right now what you see if you go there is a bibliography of papers that talk about different computer or device-assisted therapies. The mental health section is new. It contains about 110 records. I personally find it very difficult to use this site and to compare one, they may rate the scientific evidence of a particular paper, but comparing one product to another is very difficult. Now, Patients Like Me is a little bit different from what I've been talking about up to now, but it's a very interesting company that I hope all of you will learn about. It's a for-profit company. It's based in England, and it has set up patient communities for many different kinds of illnesses. The Mental Health and Behavior Forum has 53,000 some members. There's a schizophrenia forum with only about 693 at present. But if you're a member, you can go on there and you can describe your experiences. You can keep a journal of your experiences. You can chart your symptoms over time. You can enter survey data about the different kinds of treatments that you've been exposed to or used and what you think of them. There's a lot of information on the site that is educational in nature, that describes common symptoms, fluctuation of symptoms, severity of symptoms, and demographics, meaning what types of people are usually affected by these and how it varies in different countries or in different racial groups and things like that. They also provide a lot of information about treatments that are available, medications, devices, and their potential side effects and benefits. And if you're a member, you can go on there and you can rate all these different things, and the company collects this information and they sell it to clients such as insurance companies or pharmaceutical companies who are trying to, and also to hospital systems who are trying to determine whether they should incorporate these therapies, many of which have not been officially approved by the FDA or other groups. An example is the drug gabapentin, which was originally an epilepsy medicine, but it's prescribed very commonly in psychiatry for anxiety and mood stabilization without any controlled studies. So if you have bipolar disorder with anxiety, you've been prescribed gabapentin, you can go on there and you can rate your experience and what you think about it. And this information is almost as good, if you have enough information, it's almost as good as the information that's obtained from a randomized controlled trial that the drug companies might do. The next group I will talk about is Big White Wall. This is also based in the UK, and this is an online early intervention service for people with psychological distress, and it was set up in conjunction with the National Health Service, which is the health insurance plan that everyone in the UK is entitled to, and it's therefore a nonprofit. It's funded mostly by the government and by some donors. The company is hoping to expand into the United States, and they're talking with a lot of academic partners to see if they can get this going. It's also an extremely interesting site where consumers can go on, they can enter notes, chart their symptoms, and rate treatments just like in patients like me. But in this case, most of the things that are posted are monitored by professional guides, and if something seems alarming, someone will contact the patient. They also have guided support programs where groups form and contracted professionals will help groups of people with certain issues. And it even goes so far as to have professional individual therapy over the internet, which is moving into the area that we call telepsychiatry, so that people who are distant from providers can actually get regular therapy sessions through this site. Haptic is an American site, and this lists their website. And this is a project of the New York Hospital Association. It's a for-profit subsidiary of that trade association. And what they decided to do was develop an online catalog of apps. And they have about 15,000 that will launch this month. It's not fully launched yet, but not this month, but in mid-May, it's supposed to go live. And again, this is covering all of medicine, not just mental health. But they go to the trouble of scanning all of the devices for security issues and malware and the potential to infect your computer with viruses. Then they have physician advisors who belong to professional societies rate all of these things as to their functionality, user friendliness, and content. And if they meet certain criteria, the review will lead to a certification, and then providers have access to this data and can prescribe these products to their patients. So this site is different in that it's not necessarily for patients and consumers to go directly, but for doctors or other professionals to go on and have access to the information and then be able to prescribe it. Doctors and hospital systems have to pay a fee to get access to this information. And I've been interacting with this company to try to understand how they plan to do everything. I have several meetings set up with them, but right now it's not clear how much they will include on mental health. They plan to do it, but how they will go about it and how extensive it will be is not yet known. But their system of doing it for the other illnesses is very complete and very well done, so I'm hoping that this will be a good site. MindApps.org is a very good site, and the reason I like it is because it's focused on mobile apps for mental health conditions. They don't do any other branch of medicine. They contract with doctors to do a professional review, and if it passes that, then it's sent to what they call a self-help user panel. This is a group of consumers who also get access to the app and rate it. And also, just people who happen to use these can also go onto the website and post their own individual consumer reviews if they would like to. They currently have 34 products listed. Most of them are sort of for anxiety or depression and are not specific to schizophrenia or bipolar disorder, but there is quite a bit of overlap in many of these. So I found this site to be a good starting place and a model for our own work. Similarly, MyHealthApps.net is a very attractive and easy to use European site, provides mobile app descriptions and comparisons. And this does not engage professionals, but is based mostly on consumer reviews, and it collects a bunch of them and then gives a global rating. The mental health section has 11 disease categories with 70 products that are currently rated. The methodology for studying the apps and reviewing them is not publicized on the website, and so it's not clear exactly what their protocol is. And this is another group that I'm interacting with and trying to understand how they actually go about making their recommendations. So finally, I want to talk about CyberGuide, which is the project that I'm leading. And the seed money for this came from a family foundation called the Bowman Family Foundation to the International Mental Health Research Organization, which is based in California. And as we mentioned at the start, this is to provide unbiased consumer guide for rating software and apps for mental health conditions, everything from clinic-based computer therapies to apps that you can use on your phone. We launched a pilot version in June of last year, which you can see at the site listed there, and we're currently raising money to fully fund the rest of the site. We're approaching different philanthropies and government agencies to give grants to take this to the next level. So it's designed to provide accurate and reliable information for products related to schizophrenia, mood disorders, and anxiety disorders, and PTSD. We decided to focus on these first, and we have, as you can see on the slide, 15 products for schizophrenia, 35 for mood disorders, 28 for anxiety disorders that we've currently listed. Not all of them have been rated yet, but they have at least been described, and we've tried to give a very accurate description of what they do. We've included a scientific bibliography where it exists and annotated it and made comments about what the papers say about these products. And in the case of schizophrenia, we started off trying to get what we call expert consensus ratings. So we found all of the people who had published papers about these products, and we invited them to participate in a survey and rate products on at least 3 different aspects. And we got responses from about 70 people who had participated in research on these products. And so you can see on our site now, at least with regard to schizophrenia, expert consensus ratings for those products, and we're hoping to do the same thing in the other disease areas, but those are not yet posted. So we plan to expand by getting, number one, detailed expert reviews of selected products, meaning that we would have paid advisors who do a much more, rather than a survey, who do a much more detailed rating and write sort of a summary of their experience of the product. We're working on a study in England where people who have used particular products and who've been characterized as to their diagnostic accuracy and their actual use of the product to give ratings. So this is kind of a tightly controlled study of people that we know have actually used programs and used them extensively, and then get them to rate the products they've used. We're also trying to develop an open platform of consumer ratings so that anyone who wants to go on our site and give a rating for a product can do so, and then we would collect that data and show an overall rating. We also plan to get a provider database for psychologists and psychiatrists who recommend products or use them by guiding them, and have them listed so that people can find them and also get their ratings and their views on these products. So I don't have that many slides. I just wanted to give a quick overview and tell you about the field of evaluating these products, which is still wide open and not controlled by any regulatory body. We're hoping CyberGuide will emerge as the best site with the best and most accurate information. And I'll conclude by showing the slide of the International Bipolar Foundation, which provides these webinars and I think has done a great job in helping to spread information and knowledge around the country. And if any of you are inclined to support IBPF, this slide shows how you might consider doing that. So thank you for listening to me, and I know I went kind of quickly, but I'm happy to talk with you and answer any questions.
Thank you very much. We do have a couple questions. The first being, do you think the Patients Like Me site impacts whether insurance companies believe generic meds are always an equivalent medication?
I don't know the extent to which it has penetrated yet, but I know insurance companies are looking at that. And if they're trying to make decisions on paying for medications that are not officially approved, they are going to, well, many of them have their own databases, but increasingly they're going to Patients Like Me to see what the data show. And in my experience, for most generic medications, it's usually, it becomes less of an issue as the medications become cheaper. But when very expensive medications are prescribed off-label, there's frequently an argument with the insurance company as to whether it will be paid for or not. One example is Provigil, which is very commonly prescribed for fatigue and attention problems and apathy and schizophrenia, but originally it was developed for narcolepsy, and insurance companies are very reluctant to pay for it, but there actually are some data that it helps some people. And you can go on Patients Like Me and see what the data, what people say about Provigil, and insurance companies can use that to make a decision whether the claim is valid or not.
Great, thank you. Next question. My teenage son has a successful medication combination that leads to his mental health stability. I have concerns that sharing these peer websites will cause him to rethink med compliance. Do you see this in your experience?
I'm sorry, I didn't hear the very last part of that question.
Okay. I have concerns that sharing these peer websites will cause him to rethink med compliance. Do you see this in your experience?
I can't say that I've seen that directly. I have seen people sort of look at these things and question what they're taking and have questions about changing. But I would always say that if you're on a successful regimen and you want to change, that should be a collaborative effort with your doctor. And of course, people should try not to just do that on their own. I don't know to what extent people are making changes based on what they see on the internet, but I think for illnesses that are very difficult to predict, that should always be done with some guidance.
Thank you. The next question, would my doctor be the best person to recommend a website or app for me?
Well, that's the thing. I mean, I think if you went to most doctors, including me, even though I've been sort of involved in this field, if patients came to me and said, which one should I use? I currently, it would be hard for me to make a recommendation. I think in the field of cognitive remediation, I have a good handle on it because there's a lot of data. But if somebody said, which cognitive behavioral therapy app should I buy? It would be, first of all, most doctors I think wouldn't even know what's available without going to one of these sites. Second, it's very difficult still, until this field gets more advanced, to recommend one over another. So you could certainly ask your doctor, but probably most people don't know about this yet because it's so new. And I think that for the most part, consumers would know more about this than their doctors if they went on these sites and read what was available.
Great, thank you. Do you have a list of possibly top 3 for those living with bipolar disorder?
Well, if you go on the CyberGuide site, there's one product that's specifically for bipolar, which is a very good mood tracker. It doesn't provide symptom tracker, and it doesn't provide any therapy per se, but it's a very complete system of illness management, and it's on our site under the mood disorder sections. It has bipolar in the name, although I'm blocking on the exact name now because there are so many of these. In terms of the cognitive products, the best data still suggests that if you go to a clinic that uses CogPack with guided treatment, that the outcome is the best. Failing that, I think Lumosity is very good, and I think the products of Posit Science, which are called Brain HQ, is the main one, are also very good and have pretty good data behind them. I think Coping Tutor is an excellent cognitive behavior therapy, but it's really mostly for people who are having hallucinations. There is a cognitive behavior therapy app for anxiety, which is also excellent, not specific to bipolar, but if anxiety is a major component, then that one would also be helpful. I know people are working on apps that are more specific for bipolar, but they're not widely available yet. Usually these go on the market as being helpful for anxiety or depression.
Great, thank you. Next question. You noted the lack of comparative effectiveness trials of these programs, which is exactly what our research group is planning to propose to the PCORI, Patient-Centered Outcomes Research Institute. One of our challenges was to justify our choice of websites to compare, and your website will be extremely helpful for that. Are you aware of any such comparative studies underway?
The NIH has been somewhat active in this area, and because these products are not like pharmaceuticals that have a tremendous profit margin, so there are not companies that have the money to do big clinical trials. So most of the trials that are done are funded with government money, and the NIH has been trying to develop several studies that are mostly on cognitive remediation that compare products to each other and on the question of whether they can be self-administered or if you have to go to a clinic. Other than that, and then Coping Tutor, for example, has several really large studies going on, but there's no comparison to another technique. It's a comparison to treatment as usual, which is the standard way of doing these things. So I guess the short answer is I don't know a lot of studies that are comparing one intervention to another, except for the few that are funded by the NIH and that are mostly in the cognitive remediation world.
Thank you. Next question. In your experience, what features of apps are most needed that are currently not available?
Well, I think the symptom tracker world and sort of the journaling of symptoms, medication compliance, is actually pretty well developed, and there are several apps that are very good there, and to the extent they can be shared with a provider, some can be shared with a provider and some not. Those are great, and that field is pretty well developed. The field of apps actually providing an intervention is still very new. So if you get an app that says that it will provide psychotherapy to you and help you learn to cope, for example, with the nightmares and flashbacks of PTSD, the thing that's lacking most is evidence that it will really work, and evidence that the patient should invest time and money in that rather than traditional work with a psychiatrist or psychologist. So there's an evidence-based problem for most of the apps that claim to offer a treatment. Cognitive remediation in schizophrenia is the one exception because there's a fairly big literature there. And there are several products that have been clearly shown to work. The mood disorder and anxiety disorder world are kind of wide open, and so I think the biggest lack is evidence. There are also a lot of apps that are not attractive and they're not user-friendly, and people find them to be boring. They're not very engaging, so there's a big effort underway to make them more game-like and more interesting so that people will stay with them and want to use them. Some of the original versions were very kind of dull and repetitive, and people didn't stick with them very long. So those are some of the weaknesses that I see up to now.
Excuse me, thank you. I believe most of this question was answered previously, but possibly you'd like to expand, so I'll read. I agree that consumers have more information about what cognitive behavioral therapy software is available. When mentioning them to my providers, the response was that I need to interact with more people in real life and less online. My feeling is that I get more interaction the more I explore possibilities online. What are your thoughts? Am I negatively affecting my social development skills by choosing online resources to supplement my current therapy?
Well, it's a very interesting question and a very complex question, and I'm not sure it has a simple answer, but I think it can go actually both ways. So there are many people that I have seen over the years that really do best if they can do this themselves in their own house, at least for a period of time until they become more comfortable dealing with the unpredictability of group situations. And I've seen so many patients over the years that I've tried to encourage to go to groups and to support groups, therapy groups, day programs, and they just don't want to, or they're unable to, and it's difficult for them. So for those people, I think at least starting with this kind of technology is potentially better. Of course, in a perfect world, if people can learn to regulate mood and regulate reactions to social situations in the real world, that may be better. But at least the patients that I see who have more severe conditions, that sometimes takes years before you can help them resolve social phobia and anxiety to the point where they can tolerate being in the workplace, or sometimes even in therapy groups. I work in a residential program where we have people come and stay for long periods of time. And one of the core issues is this degree of anxiety about being in large social groups, what people will think of them, whether they'll be able to handle the stress, whether they'll be able to multitask. You know, if you're working in a restaurant and you have all these things going on, will you be able to handle it? So we spend a lot of time in kind of a rehabilitation mode, helping people to learn those skills. And, you know, sometimes 18 months or 2 years go by before you can get them out in the real world and doing those things. And some of these device-assisted apps can help them enter into that world. For people with less severe conditions, I think to the extent you can do this with real people in real situations, it's better.
Great, thank you. Any ideas for not quit smoking apps?
I know that's an active area, but I have never really looked at any of those in particular. And so I can't make a recommendation there. I don't know that field very well, I'm sorry.
Great, thank you. It looks like that's the last of our questions. So I want to thank you very much for joining us, and we look forward to the expansion of your CyberGuide site. We will keep track of that.
Thank you. Thank you very much for inviting me.